A fly over New York, courtesy of the US Air Force's elite flying squad, the Thunderbirds, and the Navy's Blue Angels. In a thank you to first responders, military personnel, and essential workers who've been on the front lines of the pandemic. At the White House, talk of testing passengers traveling to the US from other hotspots around the world.
We're looking at doing it on the international flights coming out of areas that are heavily infected. As you know, Brazil is getting to that category. I think they're going to be okay. I hope they're going to be okay. He's a very good friend of mine.
This as reports emerge that the official US count, both infections and deaths, may be inaccurate due to vast limitations in testing. That a lot of people might have died without receiving a diagnosis, dying at home, or without seeking medical attention before succumbing to the disease, or due to an underlying condition exacerbated by the virus. An analysis of partial data from the Centers for Disease Control and the National Center for Health and Statistics finds that the death toll was likely 50% higher between March and April.
We're doing more testing than any other country in the world by far, which we just discussed over in the Oval Office. So we're going to show more cases because we're doing much, much more testing, double anybody else. Somebody said if you add everybody else combined, that would be a number. And it will be at the appropriate time. It will be down to zero, like we said.
As a number of states begin to implement the gradual reopening of their economies amidst growing anxiety about the country's economic health, with expectations of a sharp contraction in the first quarter.
The next couple of months are going to look terrible. You're going to see numbers that are as bad as anything that we've ever seen. I think the unemployment rate is going to jump to a level probably around 16% or even higher in the next jobs report.
While in the epicenter of New York State, an aspirational date of May 15th to begin a gradual reopening, starting with low-risk businesses.
Everyone is talking about reopening. I get it. You can't sustain being closed. The economy can't sustain it. Individual families can't sustain it. We can't sustain it on a personal level. Our children can't sustain it. But we have to, when we talk about reopening, this should not be a political discussion. It shouldn't be a philosophical discussion. It shouldn't be because people are protesting or some people want it. We want to reopen, but we want to do it without infecting more people or overwhelming the hospital system.
And as we started, we end with a tribute to health workers. A firefighter rocking the US national anthem on an electric guitar outside the New York Presbyterian Hospital in Lower Manhattan. Sherwin Brycepe's SABC News, New York.